everyone, this is Daylene Barton with naturalfertilityinfo.com, and today we're going to talk about signs of infertility in both men and women. We're going to get to the women first. So these are some things, maybe in the back of your mind you've been thinking, I haven't gotten pregnant yet. I wonder if there's something going on. Maybe you already have a previous diagnosis of some sort of fertility issue, but here's some things to look for. So irregular menstrual cycles in women. So if you have a very long cycle or if you have a very short cycle, the average cycle length is about 28 to 38 days. It varies from woman to woman, but in general, that's a pretty general guideline. So say, for instance, you have a 50-day cycle or 47-day cycle or longer, or anything under 24 days. So that would be a short cycle. So something to think about, if you have very heavy menstrual bleeding, very long bleeding times, if you have lots of clotting, blood clotting, mid-cycle bleeding, absent period, you don't have a menstrual cycle at all. So those are some things that are warning signs. Something isn't quite right, something's not functioning with the menstrual cycle, and that could be a signal that there's some hormonal imbalance or other issue contributing to some hormonal imbalance. So what to look for if you think you may have hormonal imbalance? Well, irregular cycles are one. Some other things would be changes in your hair. So if your hair is falling out, it's becoming thinner, or you're growing facial hair or any sort of body hair, changes in your skin, changes in how you feel, what your mood is, depression or anxiety can be some signs of hormonal imbalance. If your skin's become real dry or blotchy, if your hands are very cold and your feet, if you're sweating a lot, all of these things, rapid weight gain without any explanation. You haven't been eating differently, but all of a sudden you're just gaining a lot of weight and there's nothing that exercise, nothing's solving the problem. So we have a lot of different hormones, but the most common imbalance would be between estrogen and progesterone. Most times women are estrogen dominant and have low progesterone, but there can be issues with DHEA, testosterone, follicle stimulating hormone, which is FSH for short, or luteinizing hormone, LH for short. So any of those kinds of things, that might be a warning sign. Hey, something's going on in my body that's not quite right. This may, be a sign that I need to go into my doctor. Age relation. So if you're over the age of 35 and you've been trying for 6 months or longer, it's definitely time to go in and get a checkup and see where your fertility health's at. Make sure nothing's going on. It's definitely harder to get pregnant for some people over the age of 35. Statistics show there's a 20% chance each cycle that you'll get pregnant. So, that's a lot less than somebody who's in their early 20s. Even though we may have not felt like we were responsible enough to carry a child in our early 20s, it's just as we age, health declines, it just changes. So, there's lots of ways to support our health. Just talking to your doctor and getting a full workup. If you have a previous fertility-related diagnosis, so PCOS, endometriosis, ovarian cysts, uterine fibroids, blocked fallopian tubes, pelvic inflammatory disease, or a history of sexually transmitted diseases, those are things that can contribute to infertility or actually cause you to become infertile. So, if you suspect something, there's tests to find out if you have those, or maybe you've already been diagnosed with it. There's ways to heal from that. It's definitely best to talk to a doctor, do some research about that. So now on to men, those male partners. Most couples don't realize that the problem could be just as much the issue with the man's fertility as it is with the woman's. So, if you've been struggling and, you've been putting all this blame on yourself, talk to your male partner about it. Say, hey, maybe you should get some testing too. It's not that difficult. It's, it's a little bit invasive, but not nearly as invasive as it is for a woman. So, definitely the number one place to start would be getting like a sperm count test. And we have those. We have at-home tests right in our shop. That's a great place to begin. But Some things to look for. So men can have hormonal imbalance too. The most common one is between the testosterone and estrogen. Men can become estrogen dominant as well for a variety of reasons, including environmental pollution, for example, exposure to different plastics and different things. Diet. So the number one reason for hormonal imbalance, studies have shown in men, would be poor diet and poor lifestyle choices. So, you know, if you're eating badly, you're not exercising, you're overweight, you smoke and drink a lot of alcohol, those kinds of things can really impact the health of your sperm and the count. So something to think about there. Some common signs of hormonal imbalance would be, and this is for men, low libido, erectile dysfunction, abnormal hair growth, getting a lot of body fat in the midsection, you know, some heart issues, different things like that. So, you know, again, thinking, oh, what is my health like? Sometimes we don't stop and think about it too often. We just get through our day. But, you know, if you've been struggling to get pregnant, it's time to start listening and getting in tune with your body. And that goes for you men as well. So there could be an issue with the sperm count, health, and delivery issues. So if you have erectile dysfunction and you're not able to sustain an erection, it's going to be really hard to get your partner pregnant. So, you know, different things. There's poor sperm health, which, you know, could involve the motility, how the sperm moves, morphology, what the sperm is shaped like, the health of the sperm, the size of it. You know, a low sperm count. Anything less than 20 million parts per milliliter of semen is considered, you know, low sperm count. So you want it above that. And I said at-home tests, great way to figure that out if you have higher, you know, higher adequate sperm count. Once you determine that, then you can move on to getting some, you know, more testing as far as like a full workup of your sperm profile. And you know, definitely talking to your doctor about that. Varicocele, which is a varicose vein, and that can block sperm from being able to, and semen to come out. Retrograde ejaculation, and as I said, erectile dysfunction once again. So any problems with delivery of the semen. So something, you know, how's your sex life? How's that functioning for you? You know, how's your libido? How have you been feeling lately? Those are things to look for. Another thing that we do not think about that much that can directly impact our fertility are other health-related issues. So, you know, we have this symphony of workings within our body, our hormones. All of these things need to work together in concert perfectly for everything to function really well. If something's off, another health problem, it can directly impact our hormonal balance, or you know, might impact the health of the embryo implanting, our sperm health, our egg health, any of these things. So we really need to think about what other health related issues that we may have, because those may impact your fertility. So thyroid issues, your adrenal health. So if you've been diagnosed with adrenal fatigue, if you're underweight, or if you're obese, body fat really matters. Not enough body fat, you might not be producing enough hormones. Too much body fat, you might be overproducing too many hormones, and mainly that would be estrogen. Diabetes definitely impacts fertility. If you have a history of autoimmune diseases, even if you have a history of them on either side of your family, that may be a warning sign. So like lupus, rheumatism, these kinds of things are a signal that the immune system isn't working properly. That can contribute to, you know, possibly miscarriage. Smoking, alcoholism, a history of drug addiction, hypertension, so long-term use of medications, prescription or over-the-counter, can impact our health. Our heavy exposure to radiation or other environmental pollution, so cancer treatments are one. So radiation or chemotherapy can actually damage sperm and eggs. So this is something to consider in your mind. And definitely avoiding environmental pollution. avoiding those xenohormones, and we have more information about that. So when should you see a doctor? So if you have any of these things and any of these issues have come up for you, you're making a connection, something's going on, it's definitely time to see a doctor if you've been trying for over a year and you're under the age of 35. If you're over the age of 35 and you've been trying for 6 months or longer, they definitely recommend you see a doctor. How can you find out more information about how these different things impact your fertility, what you can do about it naturally? So even if you chose a medical treatment, there are definite natural options to help you support healing of your body and bringing it back into balance. We have hundreds of articles at naturalfertilityinfo.com on ways to support healthy fertility, bringing the body back into balance with natural therapies. So the best way to figure out something is think of a keyword in your mind. So perhaps you want to know how smoking impacts fertility. You type in the search bar, which is on the left-hand bottom side of the search column of our menu. You type in smoking, and then you hit enter, and that will bring up a whole bunch of articles related to, where smoking was a keyword in there, and you can search through those. I would definitely look for a title, something that, has smoking in the title, so that you can figure out how smoking is directly impacting your fertility, what you can do, tips on quitting, and that goes for anything. If you have a fertility issue already, you can look on our menu on the sidebar. Endometriosis, PCOS, blocked fallopian tubes, all of that stuff is right there. You just click on it and it will bring up a whole page of information on what that is, what you can do about it. If you guys have any questions, please let us know. We love your feedback. I'm going to put a whole bunch of links to infertility related topics. And please, I hope you have a really wonderful day.